This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Hi, this is another case wherein the carousel technique of nucleus management in a soft cataract will be described. She is a 54-year-old lady who has this nucleus grade 2 cataract with an early possessive capsular opacity. Adequately sized axis is critical and it has been performed. So it's about 5.5 millimeter. It's maybe slightly eccentric. The hydro procedure is extremely important to get the nucleus mobile so that is when the carousel technique would be more efficient. So hydrodissection is done, the nucleus is pressed down to decompress on the opposite quadrant. And then in this case, I'm also doing the hydrodelineation. The cannula goes in and injects the fluid in the junction between the endonucleus and the epinucleus, and we have a golden ring. And if you can look at the diameter of the golden ring, it's just about 1 millimeter or 2 millimeter bigger than the size of the rhexis. So such sized endonucleus and such grade endonucleus in these younger patients are ideal for carousel technique. So let's understand the phaco-dynamics again. In this technique, the flow rate is going to be paramount importance because we want the lens matter to be attracted towards the phaco tip very efficiently. So we kept a flow rate of 50 and a vacuum is of 500. The energy which is used is very less in the initial part. I'm just keeping 5% torsional energy. Once the nucleus is flipped out of the bag, and then I'll be increasing the power. So the pure probe is introduced. The superficial epinucleus in cortex is aspirated. So now I'm in quadrant removal mode. The settings are 50 flow rate and 500 vacuum. The bevel of the tip is directed towards the left side. As you can notice, it is held just at the edge of the rhexis margin. And as soon as I go to foot pedal 2, suddenly the nucleus jumps in and gets engaged at the tip. So now you can see about 1/3 of the nucleus is popped out or wheeled out of the bag and is being held by the phaco probe. And now is the time to emulsify the nucleus. Now, since this is a soft cataract, I'm not going to divide the nucleus into any smaller fragment, rather eat it up en masse in a single piece. So I'm going to increase my phaco power, which was 5% initially, now to about 30% continuous torsional. And then I go into foot pedal 3 and the entire nucleus epinucleus mass is pulled out of the bag and emulsified in a jiffy. The most important parameter in such cases would be the flow rate. The flow rate is the one which would attract the soft nuclear fragments towards the phaco tip. And it's important to dial down the power in the initial stages. So I kept 5 millimeter, and then as soon as it is caught into the phaco probe, it is then emulsified by increasing the power, and the entire nucleus is eaten up in single piece. The rest of the steps are routine. So you just have the cortex remaining as the epinucleus is already come out. The cortex is aspirated using bimanual I&A. The foldable lens is implanted into the bag. OVD both in front and behind the lens is aspirated out. The side ports are hydrated and the case is done. Well, to summarize, dealing with soft cataracts in younger patients by using this technique, the carousel technique, or when the nucleus is partially prolapsed into the antechamber and then emulsified. Well, this is a great technique in such cases. The primary prerequisites would be that we should have a good hydrodissection. A nucleus should be freely mobile. The nucleus should be soft and should not be bulky so that it can easily mold itself out of the bag as the vacuum and the flow rate is built up. And then it can be consumed later by the energy. So few tricks here would be to have a high flow rate and vacuum when we do the initial part to engage the nucleus. So the nucleus management in this technique, I would divide it into 2 phases. The first phase would be just engaging one pole of the nucleus out. At this stage, the flow rate and vacuum would remain the same, that is a high flow rate and high vacuum, 50 and 500 or 60 or 600. But the power is kept very low because we don't want to chew up the nucleus. If we use excessive power in the soft cataract, we may never get a good hold to flip it out of the bag. So in the initial part wherein we're just engaging the nucleus, the power would be kept low, that is 5% or lesser. And once 1/3 of the nucleus is popping out, now is a position that the nucleus can be wheeled out. This is a time when I'm going to increase the power to 30% or 35%. The flow rate and vacuum continue to remain the same, and the entire nuclear mass along with the epinucleus can be aspirated in a jiffy. So this is one technique where, the flow rate, or rather I should say the high flow rate, does have a significant role to play. So that was it. Thank you for watching and hope you found this helpful.